The place of the immunotherapy in AML for the moment is a little bit challenging. Immunotherapy is a big word because allo stem cell transplantation is an immunotherapy, CAR T-cell is an immunotherapy, and some antibodies are also immunotherapy. So today, allo stem cell transplantation is the only way to cure the majority of acute myeloid leukemia. So the immunotherapy is efficient today in acute myeloid leukemia. For the CAR T-cell, we are just at the beginning because it's difficult to find the good target. There is some CAR T-cell about CD33, CD123, but the safety and hematological toxicity after this kind of CAR T, it's a little bit difficult, and we need, based on the preliminary data, we need to transplant also this patient after CAR T-cell therapy. Maybe during this congress, the Magrolimab was presented. So this is an immunotherapy targeting the macrophage, and maybe it could be a good way to explore with a good safety. Recently, Magrolimab had a hold from FDA, so it's stopped now. It was about the safety of the Magrolimab because Magrolimab induce big anemia, grade 3 anemia in around 20 to 30% of patients at the beginning of the treatment. So we need to take care about the around the initiation of the Magrolimab. But now we could start again to treat patients in clinical trial using the Magrolimab. And during this congress, a combination of azacitidine plus Magrolimab was presented for TP53 mutated AML, and the safety is good. The results is really promising and conduce to the ENHANCE 2 clinical trial. This is a phase 3 randomized intensive chemo versus AZA plus Magro in younger patients and in older patients. This patients were randomized between AZA venetoclax versus AZA plus Magrolimab, and David Salman presented also azacitidine plus Magrolimab in high-risk myelodysplastic syndrome, independently of the TP53 status, and the results are also really promising, with a high overall response rate, high CR rate, and really promising overall survival, independently of the TP53 status, and this data conduce to the ENHANCE trial ongoing today, and I think there is a 20% to include to finish this clinical trial, so we will have the prospective validation very soon of the data presented by David Salman.